Hi, Mike Vernon here. Have you ever seen someone with a big, bright, bloody red spot on the white part of their eye? Man, it looks so dramatic. It's awful. Maybe it's even happened to you. Well, if it has, you'll know that it's nothing to be worried about. It's a subconjunctival hemorrhage. Subconjunctival. Sub meaning under, and the conjunctiva, under the conjunctiva, which is a clear tissue that covers the white part of your eye, the sclera. And hemorrhage, which is just a bleed from a ruptured or damaged blood vessel. A little bit of blood from a damaged vessel leaks out of it between the conjunctiva and the sclera, and it doesn't take very much blood to occupy this virtual space. It builds up and it presents as this bright, bloody red spot. Subconjunctival hemorrhage is quite a mouthful. In the parlance of we professionals, we just say subconj heme. What causes a subconj heme? What are its symptoms? And what do you do to treat it? First, what are the symptoms of a subconj heme? In other words, what do you experience? The answer is nothing. You don't feel a thing. In fact, you may not even be aware that you have one until someone looks at you and goes, what is that on your eye? Or you look at yourself in the mirror and you can see that bloody red spot. Otherwise, your vision isn't affected. You feel no pain. You feel nothing. What causes a subconj heme? Well, most of the time it's idiopathic. There's no cause at all. Or it's caused by something that you can definitely hang your hat on, like trauma or surgery. The rest of the list of causes are a bit more nebulous to know if they're actually contributing to the cause of the subconj heme or not. Bleeding disorders can contribute to a subconj heme. Also, taking blood thinning medication like warfarin or aspirin can contribute to a subconj heme. Another few things that can cause a subconj heme are having diabetes or high blood pressure. But the one that I always tend to search for is, did the patient recently experience a Valsalva maneuver? What is a Valsalva maneuver? Well, it's when you hold your breath and exert force, like when you're sneezing or coughing or lifting something heavy or vomiting, or if you have a big bowel movement, you're just trying to get it out. These are Valsalva maneuvers that can increase the blood pressure in your body and cause a blood vessel in your eye to rupture. Unless a patient is having frequent subconj hemes, and in my career I've never had a patient with frequent subconj hemes, there's no further workup that I do. You've got blood under your eye. Let's treat it. So what is the treatment for a subconj heme? Nothing. You don't need to do anything at all about it. It's going to get better in about 2 weeks. That subconj bright red heme of a red spot is going to turn brownish and then a little orangish, and then it'll turn a little yellowish, and then it'll be gone. You can do a few things to accelerate this healing process. It may help a little bit, but not much. In the very beginning, if it's just happened a day or two before a patient comes to see me, I might advise them to use a cold compress to kind of shrink the tissue and staunch the flow of blood. After 2 or 3 days of having a subconj heme, then I would say, and after a few days of using cold compresses, then switch to warm compresses. Expand that tissue, try to get the blood to get reabsorbed by the body a little faster by delivering some heat to your eyeball. At any rate, whether you use the cold and warm compresses or not, the tissue around the subconj heme in the eye is going to reabsorb the blood. And once it's reabsorbed in about, like I said, 7 to 14 days, it's gone, and it's gone for good. Nothing to worry about. What causes a subconj heme? Well, it's often idiopathic.